Periodontitis is a very frequently occurring disease of the oral cavity, basically of the gums in the oral cavity, which are caused by the buildup of dental plaque and is basically driven by an inflammatory process. And what's going to happen is that due to the inflammation, you're going to lose bone around your teeth. And if this is prolonged, this stays for a long time, then at the end, this tooth will become mobile and you will lose the tooth. So this is basically periodontitis. You could say, well, but this is only a tooth that I'm going to lose. Well, it's a little bit more, because since the inflammation is so big, it will also impact your general health. So we have seen that there are a lot of correlations between the occurrence of inflammation of periodontitis and several systemic diseases like cardiovascular diseases and many others. So standard treatment for periodontitis is something which we call scaling and root cleaning or root debridement. And basically it comes down to the fact that your dentist or your periodontologist will remove all the biofilm, all the plaque and all the calculus above your gums, but also below your gums. And then after a healing period of several months, the gums will recede a little bit. They will lose their inflammation and your gums should become healthy again. So that is the gold standard treatment. Now, for many patients, this treatment is not good enough or not strong enough. So they will remain having a small amount of pockets, a small amount of periodontitis. So you could, or the dentist can improve these treatments by using adjuncts. And there are several adjuncts on the market these days. Many of these adjuncts do not work. We know that scientifically. So what works is clearly the use of some antiseptic mouth rinses, the use of antibiotics, and the use of probiotics. Now, the big problem with the use of antimicrobials, antiseptic mouth rinses, or antibiotics is antibiotic resistance development. So there, the use of certain probiotics come into the play, because we see, or science sees, that these probiotics, which are basically good, healthy bacteria, they improve the outcome of the root debridement to the same level as what you can achieve with systemic antibiotics. So Prodentis is one of these probiotics which are currently on the market. The big difference with other products is that Prodentis is the only probiotic product that has so much scientific evidence. There is not any other product on the market that has so many science to back up the claims and the effectiveness of Prodentis. So Prodentis is a product that contains 2 Lactobacillus rotary strains, which in clinical trials have shown to be very effective in improving the outcome of non-surgical periodontal treatment or from root debridement. How do they work? They basically work on the 2 main etiological parameters in periodontitis. This is on one hand the biofilm, bacteria in the oral cavity, on the other hand the inflammation. So these Prodentis bacteria have been shown to reduce inflammation on one hand, but also to kill pathogenic bacteria and leave healthy, good bacteria alive. So how do they work? 2 arms: interference with the oral microbiology, with the biofilm, interference or improving inflammation. The advice would be that on one hand, once you're a periodontitis patient, you will always be a periodontitis patient, meaning you are susceptible to periodontal disease. So go to your dentist, go to your periodontist in order to let it be treated, but also follow a strict follow-up protocol. And in order to improve the follow-up or to reduce the risk that you will have a relapse, try certain adjuncts. One of them could be a rotary probiotic in order to reduce the risk that peritonitis will start again.
BioGaia,